Enlarged prostate gland could affect people's everyday life, and sometimes lifestyle modification like adjusting the amount of fluid you consume or taking medication does not seem to help. There is a new and safe method of treatment available today. The treatment is a non-surgical procedure that takes only 10 to 15 minutes. It does not need general anesthesia and hospital admissions. Enlarged prostate gland is commonly found in men aged over 50. When prostate gland has enlarged, it may press against the urethra, causes urinary problems such as urinary incontinence, frequent urination at night, or unable to urinate. These symptoms may put pressure on the kidney to work harder. And if the condition becomes too severe, it could lead to kidney failure.
The prostate gland is a male organ, and it can be enlarged because of the male hormone testosterone. So in the aging man, the prostate get bigger if compared with when we was child. Okay, so it can compress the urethral outlet pathway. So it can cause the P problem. If we know that we have the BPH in the mind problem, we can change our lifestyle, because if sometimes we have the problem with the bowel, for example, we have constipation, it can interfere the P too. Okay, so if we can correct this problem, okay, the P problem will be better. And if we can change our lifestyle, for example, if we take a lot of caffeine content within a day, if we can stop them or we can reduce them, the P problem will be better.
If lifestyle modification doesn't improve the symptoms, medication may be needed to control urinary incontinence. Some cases need surgery for treatment. There are two standard surgical methods, but there could be a side effect from the surgery that involves retrograde ejaculation during sexual intercourse.
For the operation, you have to check your body that fit for the operation or not. Okay, and you have to take time in the operating room around 2 hours, and after that, okay, your P will feel much better. But some complications from the operation may occur. Okay, for example, we call the sexual dysfunction, especially the retrograde ejaculation. Normally, by the operation from the TURP or the whole lip, the retrograde ejaculation, we see this problem a lot.
Currently, we have an innovative approach in treating enlarged prostate gland with less invasive method, and the treatment is not only easy and quick to perform, but it also does not have a side effect like the surgery. This innovative treatment is known as Rezum water vapor therapy. It uses water vapor-based technology to shrink the size of the prostate gland and widen the urethra. The procedure is done by an insertion of a small needle scope through the urethra into the prostate gland. The doctor will then inject water vapor into the gland. The vapor will be dispersed to destroy the prostate cells, causing the cells that are blocking the urethra to be damaged. Over time, the dead cells will then leave the body through a natural healing response.
After we do the Rezum, the patient will feel his P is better, but if compared with the standard, maybe the standard is maybe better, but the sexual dysfunction from Rezum is quite low if compared with the standard operation. First, the man who don't want to take the medication for continuously. The second, the man who's still concerned about the sexual function. And we may consider the Rezum in the man who need the surgical intervention, but he is unfit to do the standard operation, like a whole lip or the TURP. Okay, we can choose to do the Rezum.
Rezum therapy has been an effective treatment and a great choice for many patients.